Hello, everyone. Thank you for taking time today to join us for our webinar. It's our final webinar of this year's series. My name is Kara McCaffrey, and I am honored to be the Construction Suicide Prevention Week 2026 Board Chair. I am also third generation owner and Chief Wellness Officer at my family specialty commercial construction company based in Pennsylvania called Houck. I grew up in construction along with my brother Gary and spent many years working in the industry with a decade-long break in between working in construction where I spent time in healthcare IT, focusing on suicide in a clinical aspect from medical software. So I care so much about suicide and mental health, and I'm part of Construction Suicide Prevention Week because I lost my brother Gary to suicide in 2005, and I know that he is so proud of the work that we are all doing together to make a difference in construction. What started as a regional initiative in Kansas City in 2019 has grown to a nationwide effort to bring awareness to the public health crisis of suicide and mental health challenges in the construction industry with a goal of saving lives. Last year in 2025, more than 700 organizations representing more than 500,000 workers across nearly all 50 states and U.S. territories participated in Construction Suicide Prevention Week. We're hoping to exceed those numbers this year. Let's reach 1 million workers. Wouldn't that be great? If you have not already, please be sure to register your company's participation on our website for free to receive your OSHA recognized certificate. Our website is www.constructionsuicideprevention.com. If you don't register, we don't know how many people we're actually reaching, so it's really important for us that you do that. With more than 8 million people employed in construction in the US and far more worldwide, we still have many more people who need access to the tools that could save a life and reverse the trend that has placed construction as an industry with one of the highest rates of death by suicide. The Construction Suicide Prevention Week initiative provides free resources to people in and around the construction industry to help them start conversations, hold stand-down events, and share information with coworkers who may be struggling. Our goal is to put more tools in the hands of the people who build our communities, and this webinar is one of the resources that we're proud to be able to provide. We want today to be interactive, so please feel free to submit questions through the chat or Q&A. We'll be monitoring those and have time later on at the end of the webinar to address them, if not during the webinar. Before I introduce today's speakers we have with us today, I wanted to say a huge thank you to all of our 2026 CSPW sponsors who make these webinars possible. Today we have one of our capstone sponsors with us, STO Building Group, and they will share a few remarks before today's program. So Greg, go ahead, the floor is yours.
Well, thank you, Kara. And I'm sorry for your family's loss and appreciate your background. Also, Pennsylvania resident, grew up in Pennsylvania, traveled quite a bit. But I'm here to really talk a quick minute about STO Building Group. So we're a family of builders, and we really believe in the word family. Many owners within this. We have about 50% of our employees are owners in the company, which is great. Our model really helps provide added resources to our teams that are all over the country, Canada, also in Europe, in the UK, Dublin, Amsterdam, and moving into Berlin. So we highly believe that mental health and the work that CSP is doing just to help everyone get through this. You certainly covered the culture of construction and how difficult it can be, and why we're all here trying to help all of the folks, not just our tradespeople, but even our professionals who are also certainly at risk for mental health. A couple things that we do at STOB, which are unique, is we started a superintendent roundtable so that myself and the C-suite at STOBG could have a real connection to those that are walking day to day on the projects. The Superintendent Roundtable believes heavily in making sure that mental health is a conversation, that we bring that to the forefront. And again, just like today, we need to talk about it and let people know that it certainly has affected me in my life, that, perhaps it's just that, how are you doing today? Do we need to have a cup of coffee? Is there something that we can talk about? That language needs to really start to permeate more and more through the industry. The company itself has embraced an initiative called Thrive 360, which some of my friends, Abby Klein and Katie Carrera, have been really pushing at STOBG, and that is a grassroots getting to our folks and making sure they have the tools to help all of our people that are out there in the field. And then finally, our industry really faces the challenges. We know it takes work, it takes courage. And I try to talk to many of the groups that are with that sometimes just intervening and checking in with people. It's not as easy as it may seem, but it's the courage to do that. You could change somebody's life. And, sometimes we don't know the effect that we can have, but if you don't try to engage with that effect, we certainly won't know that it wasn't beneficial to somebody and could have pulled somebody out of a very dark place. So we do encourage that. And thank you again for having us and giving us a few minutes to say hello to everybody on your webinar.
Thanks, Greg. Thanks for sharing, and thanks to STO for supporting us and all the work that you do supporting mental health of your employees. It was really inspiring to hear. So thank you so much for being here and for your support. We can move on to today's program, and I'd love for Sonya and Ryan to introduce themselves. Our speakers today are Sonya Bohmann from CIASP and Ryan Price from AFSP and Houck Courage. One of CSPW's goals this year was really to deepen relationships with others in the industry. So I'm so excited about this webinar. It's one way that we can show that relationships that we have. So I'll go ahead and, Sonia, did you want to go ahead and share an introduction for yourself with the group?
Absolutely. Thanks so much. My name is Sonya Bohmann, and I am the Executive Director of the Construction Industry Alliance for Suicide Prevention, CIASP for short. We are a 501c3 that focuses strictly on construction, mental health, and suicide prevention. We have free resources. We have things like toolbox talks. We have lived experience videos. We have a needs analysis. And a safe messaging guide, all specific to construction, and they are created for the construction industry by the construction industry.
Thanks, Sonia. Ryan, would you like to introduce yourself?
Yeah, thank you. It's so glad to be here. Ryan Price, I'm a Senior Director of Special Projects at the American Foundation for Suicide Prevention. And one of the initiatives I work on, most of my time is spent on our initiative called Houck Courage, which, similar to CIASP and a lot of other resources I think you'll hear about today, are built by the construction industry for the industry. They're free and available. At the American Foundation for Suicide Prevention, we've been around since 1987, and we're the largest private funder of suicide prevention research. So we took what we've learned from research and from delivering public health type education into general communities into the construction industry and coupled that with expertise from a CEO advisory council and several different partners along the way. So, Kara, thanks for having us here today.
Yes. Thank you both for being here. It's been really neat to see the different groups. So when you look at CISP and CSPW and AFSP, we have crossover in the board that we have and in the volunteers that volunteer within our organization. And that's just so neat to see the different passionate people that overlap and care about all of our missions. I also know that CISP and AFSP are together in the OSHA Alliance. So you folks have worked together before in that. And from CSPW's perspective, I know we're really excited about our relationship with Sonya and CISP supporting your virtual 5K this September. We're excited to have a team for that and a podcast that we did recently together. Ryan, maybe a little bit later you can share too about AFSP and CSPW, so many acronyms, the new video series that we've been working on. So it's such an honor to work with all of you, and I'm just so excited to be able to highlight all of our groups today as part of this webinar for others to learn about other groups that are doing important work in the industry. So I would like us to dive a little bit deeper now into our organizations and what resources and tools we have, because everyone listening, they might know about, CSPW, but they might not know about AFSP or CISP. So I want to give us some time to go through that. And I can just touch briefly on CSPW. I know I already mentioned a little bit in the intro about us, but CSPW, Construction Suicide Prevention Week, is the week of September 14th this year in September. It's during National Suicide Prevention Month. It's during National Recovery Month in the month of September. But it's not just the week. We really want people to start the week and then make it part of their culture year round. It's really meant to be a starting point to get companies engaged in this topic. And then whether you're using our resources or Sonia's or Ryan's or someone else in the industry, then you're having that conversation, you're embedding it into your every day to day. But we do really want to focus on that week again as that entry point and that starting point for folks. So the week itself is free to participate in. On Monday, we have the National Moment of Silence stand down. It's at a different time, depending on what time zone you're in, but everyone comes together in that one moment of silence. And it's a great way to honor those that we've lost along the way, but also make a commitment to build a healthier future together. So that's a really great event to focus on if you're participating this year. And then we also have a pledge that you can sign and your employees can sign to learn about one new mental health resource. So those are some things that you can do specific to the week, but we have other free resources on our website available year round that you can do during the week itself or at another point in the year. Maybe May for Mental Health Awareness Month would be a great time to do it. You could do one of our toolbox talks. So we have several different free toolbox talks in both English and Spanish. We're really proud to say that we just released 10 new toolbox talks. So check out our website for all the different topics that we have. And we have different webinars like you're seeing today, which are always recorded. And then you can go on and watch them later and share them with your coworkers. I think there's a good view on it's not just the field, but there's also folks, in the office. Greg mentioned that it can be anyone who's impacted in the construction industry. So whether you're in marketing or safety in the office, in the field, there's always something that you can do, and you can always check in with your coworkers. And the webinars have good tips on kind of all of those things. So check those out. We have stand down agendas and more. So go to our website, www.constructionsuicideprevention.com, to see all of our different free resources. Please register in the week itself, but then remember that there are other organizations doing this important work too, and you could use their resources. So that's a little bit about some of what CSPW offers. But Ryan, how about I start with you? Can you explain a little bit more about Hard Hat Courage and share some of the resources and tools that you all are offering to the industry?
Yeah, I think a lot of it is similar, and it's a sort of a trend in construction suicide prevention because there are normal practices like toolbox talks, like opportunities for training that exist on job sites and across companies in various forms. So a lot of the things we have are similar in nature. I think what's maybe not different, but a little bit unique to what we're able to offer is that Hard Hat Courage is an initiative that received funding from Bechtel, and that has enabled us to provide a lot of different like technical assistance and training for presenters. So, one of the things that sort of we are really proud to offer is our flagship presentation, Talk Saves Lives, for the construction industry. It was something that we at AFSP launched about 10 years ago, 10 or 11 years ago, something like that. We tailored it for the construction industry, and it can be presented in 20 minutes, in 60 minutes, with or without slides, and without slides in like 15 minutes, for like a road show around a job site or something like that. So there's a lot of like different options. And I think to anyone listening who's maybe not sure where to start, I think anywhere is a great place to start. Through Hard Hat Courage, there's a lot of similar resources, and it really just depends on what your needs are, what your company's needs are as well.
Great. Thanks, Ryan. Sonia, do you want to share more about CIASP and some of the resources and tools that you all can offer?
Absolutely. Kara, I think I would talk about first and foremost the pathway that you had
Sure.
a huge role in. And our pathway really is an opportunity for someone who doesn't know where to start to build their own mental health and wellness program. So you start by taking our pledge that we've had for many years, and it's a pledge to stand up to suicide prevention. STAND is an acronym for us. S is for safety, T is for training, A is for awareness, N is for normalize, and D is for decrease. So all of our resources sort of build around that acronym. We have toolbox talks that go with them, and we also have something called a needs analysis. And that allows a company to recognize that although you might feel like you're not doing anything in this space, you probably already are. So if you've got an EAP, you're doing something in this space. If you have 988 stickers up, you're doing something in this space. And what we sometimes look at is that this is such a huge daunting task, and we get lost in the sauce a little bit. So that needs analysis really allows you to say, this is what I have in place. Here's who's responsible for it. And then show you where those gaps are. And then from the time that you establish what those gaps are, you can then go out to the pathway. And then we have your resources broken out into prevention or awareness, intervention or training, and then postvention or crisis management. And you can then put together the program that you need or find the tools that you need depending on how you enter that conversation. Some of my favorite tools are obvious are toolbox talks because we know everybody uses them on a really kind of regular basis, but we also have on our website a free mental health screening tool that anyone can use. It's a 5-minute tool. And at the end of that assessment, you are able to take it to a doctor and they can scan a QR code, which will help move forward the diagnostic process. And what we know about diagnosis for mental health issues is that it sometimes takes 10 years to get a solid diagnosis. And so our hope is really that little assessment will help move that process forward for someone. And then finally, our most recent and exciting tool is that we created a lived experience video, and we actually did that with one of your
Yes, Chris.
advisory members. Yep, Chris did a great job in sharing his lived experience with mental health on a construction job site and what that looks like and how you can come through to the other side. And then we had 3 other participants, Mike and Santiago and Julia, who shared their lived experience through mental health and addiction and what that looked like for them. What's great about it is it's a 10-minute video in whole, but there are then 4 small snippet videos that are less than 2 minutes apiece that someone could use on a job site to really start the conversation. And we've got some companion tools to go with it so that people could use them in their day-to-day work life.
Yeah, those videos were so powerful and wonderfully done. So if you haven't checked them out, please do so. Thanks both for sharing a little bit more about your organization. I'm sure we can sprinkle in other things throughout as we go through some questions that we have planned. But thank you for the work that both of you are doing and offering to the community. So let's get into what construction companies can do. They can use our resources, any of our resources, but let's talk a little bit in more detail about that. What's one piece of advice each of you have for a construction company who doesn't know what to do next, doesn't quite know where to start, but does want to support their workers' mental health? What's one thing that they can do to start? Sonia, do you want to go ahead with your opinion here?
I think it's super easy. I would say start with taking the pledge. Take our pledge, take your pledge, take somebody's pledge. It really signifies to your company that you're serious about this conversation. And then start putting up some 988 stickers. It's really that simple.
Just having that awareness and that visual
Start with
representation
awareness.
for, yeah,
Yeah.
yeah,
Start with awareness.
and making that commitment. Ryan, what about you? What's a piece of
Yeah,
advice you have?
I would totally agree with you, Sonia, on that. And also, a lot of it's sort of an impulse, and we drive that too, to educate your staff on suicide prevention. But if you're not quite ready for that, you can start by educating your staff on the benefits that they might already have access to. If it's an employee assistance program or a member assistance program or the health benefits or something like that, start letting people know. I know one of the things that I'm always surprised about is, the fact that like a lot of employee assistance programs will offer free mental health counseling appointments for everyone in the household. You have to check your own program to make sure that that's the case. But even just starting by educating people about the resources they have available, as well as, taking a pledge, putting 988 stickers up, I think those are all great.
Karen, not to turn this back on you,
Well, I was gonna,
but
I know where you're
I
going.
will. I tell this story all the time when I talk about mental health and what companies are doing. But you have such a great story about just talking about the EAP and what it did for your
Yeah.
utilization.
Yeah, so our employee assistance program at my family company, we've had for probably 20 years, but no one really ever used it. We had it, but we didn't really tell people about it enough, and they never used it. And so I have a graph that I show in presentations sometimes of showing, okay, before we started talking about it, there was like a half a person a quarter or something that used it. And it has tripled, quadrupled, and it has stayed consistent and grown even more just by when I first started at my family company, the first email I sent was about the EAP, and it was Suicide Prevention Month. And it started then. Within 3 months, it tripled just the usage. So it doesn't have to be something that you have to have this huge plan. And I mean, it's great to have communication plans and to have a strategy and do it throughout the year, of course, but just talking about it and letting people know about those benefits. I think you never know when someone might need it or when they need it in that moment. So I think, yeah, Ryan, you're spot on like just letting people know about the benefits they have, because if you don't talk about them or you're not making people aware of them, they're not going to know, what they have and what they have access to. And the EAP too, I've learned other things that they give to employees. It's not just mental health support, but at least our EAP will give legal support. They'll give elder care support. So they give discounts on other related services that can just help your stress level and your day-to-day life. So I think knowing what benefits you have at an organization and promoting them. August is National Wellness Month, so we're just sharing all of our different healthcare benefits to our employees. So it's very timely that you said that, but definitely making folks aware of that, because that means there's real people using those benefits and getting support that we need. Awesome. Okay, let's talk about the companies that are already doing a lot. There are plenty of companies who are doing a lot to support the mental health of their employees. But what's something else they can do? If they already feel like they're doing a lot in this space, but they don't quite know what to do next, what would you tell a company who is already doing a lot in this space to consider? Like, what's a next level challenge for them? Sonia, what do you think about this one?
I would say do the needs analysis. That really lets you know very clearly what you have in place, who's responsible for it. Because frankly, if you think you have it, but no one's responsible for it, you don't really have it. So having
Good point.
that checked off, and then you can very clearly see where your gaps are, and then you can figure out what you want to add to the conversation.
Good suggestion. Brian, what do you think?
Yeah, I would agree. And at Hard Hat Courage, we're developing a tool that's like a toolkit that kind of helps you with those next steps and links to things. But I do think one of the pieces that can sometimes be missing until there's a need for it is, what do you do after a suicide? Whether that is a suicide that it is someone's home, but it's at like a family member, and it affects the workplace in some way because someone has to take time off, and you're not sure how do you talk to that person when they come back? Or if it was, someone that worked in a company or on a job site that dies by suicide, there's some important steps to take after that happens that can help reduce the contagion, or other people that might, be struggling and think about suicide. It can reduce that and also help you communicate effectively and provide the right level of support. But sometimes there's a tendency to wait until you need it to do that. So I would suggest another thing too, if you're doing a lot on the prevention and education side of it, to think about, is your company ready to respond if a suicide impacts it? And then, you can go to hardhatcourage.com or CISP or any others, or many others, I should say. We have an after a suicide guide that kind of walks you through step by step. But there's a few things you need to do ahead of time. We were just working with a company last week that was like, do you know of anyone that can do this service right now because this happened? It's better to identify that ahead of time, kind of
Yeah,
have a plan, have a team that's ready to respond if that does happen. That
yeah.
tends to be a step that it's can be overlooked because it maybe happens infrequently enough that it's something you just don't necessarily think of all the time.
Yeah, but so be prepared in advance if that were to happen is a good
Yeah.
suggestion. Actually, I
Hmm.
just last week I gave the document that AFSP has that's construction based, the postvention, to someone who unfortunately lost someone. So I was thankful to have that resource that went through more about postvention. So thank you for that. But that's a good suggestion. And actually, there's something in the chat that I think would be useful to talk about now as part of this. Construction companies. About training, and the different trainings that are available, because construction companies might think that they're doing a lot in this space, but there are so many different additional trainings that can be done. And James had mentioned about getting people comfortable with talking about the uncomfortable, and how I love that, and how training can be key to that. So are there any trainings that you would suggest to construction companies to take? I know, Sonia, you have Living Works through CISP. So if you just want to chat a little bit more about the trainings available for folks.
Well, I think there's a tremendous amount of trainings out there, right? I think they fall into three categories, and it's important to recognize that not everybody needs every one of the categories. So there's gatekeeper training, which is introduction to suicide prevention, and that's Living Work Start training. It would be our presentation that we do. I think probably, Ryan, you guys consider Talk Saves Lives like a gatekeeper training, right? It's that initial training. And then you have connector trainings, which are that next step where you're really practicing with somebody how to ask the question, are you thinking of suicide? And so those would be things like Vital Cog, if specific to construction. If you're looking at Living Works training, it would be their Safe Talk. And then there's that next level, and that's for someone who really wants to be a champion, someone who feels like they're in a position to be able to support someone through their crisis. And that would be things like if you're looking at Living Works, you would look at their assist training. If you are looking at mental health first aid, that would be that. It is a big commitment, though, and those trainings really need to have someone who wants to be that person that will stay through the process. And that's not always for everyone. In my opinion, and Ryan, you can tell me if you agree or not, everybody should have gatekeeper training. We should all know what those warning signs are. We should all know how to refer someone to help. We should all know how to connect somebody with their EAP or 988 and get them to those services, and then figure out if you should move on to the next steps.
And I think one thing that this just made me think of, Sonya, too, is in the pathway, one of the pieces that we tried to focus on in that is all the different trainings that are available because there are so many. And like, I loved your explanation of separating it like that, but that's also something that the pathway can describe. Ryan, what were you going to add in?
Yeah, just that in addition to the sort of levels that Sonia described, that sort of awareness level of warning signs and how to check in, that deeper sort of skills-based level, there's also availability for lots of different options within construction.
Yes.
So there's things that are tailored for construction and those that aren't. They're all basically drawing on the same research in suicide prevention. So it kind of depends on your need. There's also a consideration for cost as well.
Sure.
So if you think about, the upfront cost of, workbooks and materials and things like that, that can be prohibitive because you're also thinking about carving off payroll time for anywhere from 30 minutes to 16 hours in some cases for these training programs. And so that's one thing I think also to consider. And like CIASP and a lot of other organizations, Hard Hat Courage offers training in all of those areas that start with something basic like a toolbox talk and goes up to a 3 hours skills-based sort of opportunity to practice that can be done both in person and virtually. It's another consideration as well when you think about training is how is it going to get delivered and just working with an organization that can help you and your company with a program or a presentation that meets your needs.
Yeah. Yeah.
Absolutely.
And I think just training in general is so key to make sure that people understand. And so thank you for bringing that up in the chat. I think that's a great one for construction companies to make sure that you are doing some type of training, regardless of what it is. And that was helpful to hear your perspectives on some of those differences. I know too, CSPW is really excited about the videos and the training that we're working on together with AFSP that will be released soon. So watch out for more information on that, trying to get more intro level to the folks in the field. But there's a lot out there, but training is definitely key to make sure that people are comfortable talking about the uncomfortable. I like that saying. Let's move into another question. What's a creative or unique way that you've seen companies address this and support worker mental health? Anything you'd like to share on new and upcoming kind of creative ways that you've seen folks handle this? Sonia, what do you think? Have you seen anything recently?
Have actually. I was with a couple of organizations last week, and one of the companies that's really leading this conversation has interns, and they ask their interns to create toolbox talks. And amongst them, they have a little competition. And so the interns then have to present to a little board or a panel that the company as of company leadership, and then they have to present them to superintendents, and then the superintendent they have to train them through. So it really gives the interns not just an opportunity to create a toolbox talk that then everyone can use, but it gives them an opportunity to learn some presentation skills, to get comfortable, to
Yeah.
understand how industry works. So it's really a great opportunity to sort of sharpen their tools in many
Yeah.
aspects.
That's neat. That's really neat. What
I
about
have
you,
a
Ryan?
couple examples to share if that's okay. They'll be
Yeah, go
brief.
ahead.
One
It's
of
okay.
them was around a company's open enrollment time, where in addition to communicating to employees about the benefits and timelines and things like that, we also worked with them to create a little flyer that they sent to home addresses. It also had the 988 sticker and some information on warning signs and things like that, so that for those that work in construction and have family at home, that the family also would be a little bit more prepared to, maybe recognize the warning signs in their loved one and check in with them. That was one really unique way to think about, getting that information to people in the home. Another one, it's a little more nebulous, but this company is and has been doing a lot of training and sort of structural things within the organization to prevent suicide. But one of the things they were looking at is totally rethinking how they assign people to various projects and looking at it from, it used to be or currently is like a sort of crew team based thing where you're on a sort of small crew and you go to do this thing. It's really anonymous. Like as an individual craft professional, you're just sort of on that team, you're sort of anonymous. And with if something on the team fails, you're sort of like punished for it too. So they're looking at how do we make it more so that there's sort of an individual incentive to perform or to, have a chance to work with different people and create camaraderie in a different way. And so they're just looking at every single angle, and I thought that was so unique.
Yeah, it's like really adding in the connection and community that really helps, partly prevent suicide by having that connection. So that's really neat. I also really am glad that you mentioned about sending things home to the family because we try to do that at different times throughout the year too at my family company. If anyone's watching from my family company, I hope you read my emails, but my guess is you might not read all of my emails. And so that information also doesn't go back to the wives or the husbands or the spouses. And so we try to send things home, like with that hard mailing with the benefits that I just talked about for August. We sent that home to the family so they know what benefits they have access to too. And I think making sure that the family is a part of it and understands how to support and also what they have access to is really important. So love that you mentioned about the home mailings to the family. I think something that I've heard more and more about that I'm excited about that's kind of creative as a way to support people. Of course, I hope that all organizations listening have an employee assistance program. They offer healthcare insurance to your employees that they can get connected to therapists with too. But something that I've seen some organizations do a little bit more of is having more direct healthcare with people. So some larger job sites that I've heard of having like an actual, not just a healthcare, physical doctor or physical therapist on staff, but, once or twice a week, having someone come into a trailer that's a licensed mental health therapist and being able to support people in real time at the job site. And I know not every company has the the staff or the resources financially to do that like large general contractors might. But I have seen some smaller groups do it too. There's someone that I'm connected with um, that has a licensed social worker on staff that they direct contract with and she's not there every single day, but she is there a lot and they can work directly with that person. And I just think that direct care is something that can hopefully break down barriers and create more access. Something that we're trying at my family company, it's partnering with a startup organization called Tectonic Health that does direct primary care, but they also partner with a mental health therapy counseling service that you get up to 20 sessions for free with that mental health therapist for the family too. So really having the person come to the job site or the office or even the home and providing that direct care, even if it's just physical care, they're not ready for mental health support, just taking better care of your physical health and knowing that there is that support there, I think is really helpful. So that's something that I hope more and more people, look into and I know as a business owner, it's another expense that you're adding, but it really helps with the access to healthcare and removes those barriers for people to get care, whether it be for their physical health or mental health. So that's something I've seen, and it's been
Mhm.
exciting to see different companies do. Um,
And if I don't mind, Kara, if you don't
yeah, go
mind,
ahead. Yeah, go
I
ahead.
think that's such an important point that you just raised because our health is our health. So our mental health is a part of our physical body. Our brain is not like some separate thing that's, totally different. So when we're recognizing if there's a sort of underlying chronic illness when we're working with a doctor to like improve our sleep and diet and things like that. There's also positive benefits to mental health as
Hmm.
well. So it doesn't always need to be like a very specific mental health thing. Like that kind of physical care, taking care of your body can really help improve mental health as
Yeah.
well.
Yeah, good point. And I think that's, Sonia, thinking about your virtual 5K in September, it's like moving your body and miles that matter. And whether it's biking or running or whatever, like you're moving your body and that can, help your mental health. The other thing that this just made me think of is financial health too. Can organizations train their employees on budgeting, how to budget, how to save money? Are you offering financial benefits like a 401k? Because we know that if you're financially stressed, that can impact your mental health. So I think thinking about all aspects of someone's health can improve their mental health and is something to think about as a company for sure.
Kara, some EAPs actually offer financial literacy. So that's
Yeah,
something to think about as well. I mean, just knowing the breadth of what your EAP covers is really, really important because
yeah,
there's so many options that people just don't take advantage of, but they have them available to them.
yeah. I know we've partnered with our local banks too, who will provide training on financial education too for free. So for those listening who think like we can't afford to do something like this, like Sonia said, look at what you already have. Look at your
Right.
EAP. They might already offer something like that they can give, or look at other vendors that you have that might be able to partner with you to help some of that education. But thinking about what you can offer your employees as far as education, we talked about training from, mental health standpoint, but also, financial education. And I think it's really important, Ryan. I'm glad you brought that up about the physical connection and thinking about that too. Anything else to share that you'd want to give to attendees about any other creative or unique ways you've seen people focus on this? Maybe it's not traditional mental health, but we talked about financial health too. Anything else to share before we move
Yeah,
on?
one other thing came to mind. I've heard on a couple of job sites that, the discussion around sobriety is a really important topic. And again, it's sort of like the mental health piece of this, where when leaders, make a commitment or express an openness to having conversations around mental health, and the same is true for sobriety. And so, if there's opportunities to have discussions around, substance use, bring in a group or allow even someone to host a, NA group or something like that. That can also sort of normalize that part of the conversation around mental health, which we know in construction, substance use is
Yeah,
fairly
it's very
high, and it's a
connected.
really an important topic. And if you open the door to like, hey, this is important. So if you're interested in learning more or you want to have some support in your sobriety, like companies can create that opportunity for those connections to happen as well.
Yeah.
That's such a great point. I know that we both know that peer-to-peer support is huge, especially in mental health, but we've seen really good success in construction. You'll hear if you listen to our Stronger Than the Silence video, Chris said it, but so did Mike, that, I can listen to a doctor or someone else tell me what to do, but knowing that guy that has lived it and has had the same experiences that I have, that they were able to get help, I'm going to start to listen to that.
Yeah. And I'm so glad that you brought that up. And it is such a connected topic to suicide, and a risk factor that contributes to that and adds additional stress to someone's life and relationships and family. And having folks who, live that and are willing to spread that message. So if you can find those people at your organization who are willing to share that, and September is Recovery Month, and there's different groups in the industry who are having, Safe Projects is one who has information on substance use, opioids, so there's plenty of information out there, but I think that's another topic to really focus on to help people become healthier and to protect their mental health. So that's a great topic.
Absolutely.
Now, we've shared a lot of ideas, different things that people can do if they're not doing anything, if they're already doing something. So I'm really hopeful, and I know that folks will take away at least, a few ideas, but there might be people out there thinking like, I I can't do all those things that you just suggested or gave us ideas on. Like I don't have the staff, I don't have the resources, the money, the time. I can't. Maybe it's a really small company or they just have too many other priorities. So if someone's listening that feels like they don't have all that, they don't have the staff, the time, etc. What's one thing, something easy that they can do right now today to help still make a difference? Sonia, what do you think? What would you say?
This is my favorite question, and my answer is really simple. Change your email signature. At the bottom of your email signature, just simply say, if you or someone you care about is in crisis, contact 988 or text 741-741. Doesn't cost you anything, but it automatically sets you up as an ally.
Yeah, they're always going to get that email response, and you see that on the
We
bottom.
send
And yeah,
hundreds of emails out a day,
yes,
hundreds, and
yeah,
reply to hundreds of emails a day. Look at how many people you're touching with that
yes,
message. Then.
for sure. And that's a super simple thing, no cost to
No
do, doesn't
cost.
take you that
Yep.
long. So that's something you can do. Ryan, what would you say?
Yeah, I think just start the conversation off, and even whether that's at a job site, you can mention it to a crew. Uh, the fact that mental health is important, and if there are leaders in the organization, your company, or if you've been impacted by mental health in some way, which we all have, just share that story. Share a story about your family member or someone that got help. But encourage those conversations, make it a normal thing to talk about, and to normalize help seeking is a really important way that you can do that in a conversation.
And I think that help seeking is so important when we look at the issue of suicide in construction because we want people to be able to ask for help and see that as a strength and not a weakness, and really changing that view of how we look at it and normalizing it. I think something for me that I think is easy to do, and we talked a little bit about this before, how there are certain things that are just already ingrained in construction that are day to day and normal operations, and that makes me think about just physical safety that every construction cares about physical safety and talking about fall protection or ladder safety or heat safety. So, how can you incorporate mental health related topics into that already normal and standard talks that you have, whether it be a stand down or a toolbox talk? We've talked about, all of us have free toolbox talk. So for those of you who don't have the time to write it, you don't have to write it. You can just go to our website and find our free resources for toolbox talks that you can use and go ahead and just do one of those with your normal or in replacement of your normal toolbox talks, because the more that we can talk about people being safe both physically and mentally and just making it the whole person is going home safe at the end of the day. I think that helps to your point about normalizing, Ryan, too. It's just normalizing help seeking and normalizing talking about mental health. And so I think that's an easy thing to do because they're already written for you. You do have to get your safety director or foreman to do it. I'm so lucky at my family company that they're really supportive of that. But just start incorporating that and making it part of your physical safety routine, I would say. But I love the email signature, Sonya. The other thing too, you talked about sending a lot of emails. The other thing that a lot of folks do are social media posts. So if you see a social media post of CIASPs, like the virtual 5K, or if you see a social media post from us about the new toolbox talks that we have. We don't all have the same followers. So if you just share that social media post on your page, that's going to impact and have a ripple effect for other people to see these free resources that we're sending. So even if you feel like you can't do something at your company today, share one of our social media posts because that might hit someone else, whether it be an employee or another company, and that will hopefully, get people to see more about what's happening and the work that we're all doing. So that's another simple thing. So more ideas for you to take away. Hopefully you do one of those easy wins. All right, last question for you before we go into Q&A, and I'll check out. I know we had a few questions come in. Last question I want to ask you each is, what's something that excites you about the work being done in our industry or that gives you hope for the future? To end us out, Sonia, what do you think?
Collaboration. We know that we are stronger together. We know that when we work with each other, when our voices are amplified together, that we are reaching more people, that we are touching and saving more lives. And that's what really excites me, is being able to collaborate with great people that believe the same things that we believe, that this is really about the mission and not building a monument.
Thanks, Sonia. Ryan, what do you think?
I think what I've seen, in recently, like CPWR, they noted that rates seemed like they declined maybe almost 2% in recent year, and that gives me hope. But also just the fact that where we are today is so encouraging because this really wasn't a documented challenge or issue in the construction industry until a few years ago. And since then, since the CDC report came out and there was some organizations getting some momentum, the industry has really recognized that they have a role to play and they're willing to change, they're willing to listen. And it's driving conversations at the highest levels of the largest companies that's now influencing the up and coming, people that are still training for their trade. There's a cultural change too, to where the younger professionals that are coming into the trades have been exposed to conversations about mental health earlier on in their schooling and are just in the United States, the conversation has been different in recent years about mental health. And so we have this great mix of new professionals coming into the field that have more comfort talking about mental health. We have industry company leaders who are saying, yeah, we recognize that there's something we can do. Let's do something about it. And so that gives me hope because it's driving results. We're seeing more and more companies want to get engaged, whether it's through Hard Hat Courage or other organizations. And so it gives me hope that there's momentum within the industry to sort of take this on, and do something about it.
Yeah. And that reminds me when I think about kind of what I'm excited about and proud of, it's all of us working together in the industry. And I remember when I was still in healthcare IT before I came back and returned to the construction industry, I didn't know that anyone in the construction industry was going to care about this. Like I thought it was just going to be me. And I had read the stats from the CDC. I think it was, from 2016 that really started, the showing that there was a huge issue. And I read those stats and then I had this passion, this experience, and I wanted to come back. And I thought, is anyone else going to care about this? Like it just seemed like this massive, big problem. And I felt a little, not a little, a lot scared, that I was going to have to do this by myself. But then when I came back to the construction industry and got connected to folks, I think, Sonya, you were one of the first folks that I got connected to and we got to present together
You did.
um, at NRCA. And, I started meeting folks like both of you and others in the industry who care so much about this and the groups who are already doing work. And I was just so pleasantly surprised that there is so much work already being done in the construction industry. And I do just agree wholeheartedly that we are stronger together when we work together and we promote each other and make sure that folks are doing something at their organization to take care of employees' mental health. It doesn't matter if it's our resources or yours, but we really want to make sure that we're working together to save lives in the industry and all work towards that same mission. So I'm just so proud of so many people working together on this. And I'm just so honored to be a part of it. I'm so thankful that I came back to construction and that there's so many wonderful people like you and those on our board that care so deeply about this. I'm just so honored to be a part of it. So thank you both. I think what I'd love to do next is go into some questions. We had a couple questions come in to the chat and kind of wrap up with Q&A time before we close out our webinar because we're nearing almost our hour mark. But this has been such a great talk. I feel like I've learned new things talking to both of you. So thank you for being here. One question that came in through the chat was for the panelists, what would you recommend for collecting data to show impact of these initiatives? Which I think is a really good, question to ask because, making sure that you're getting buy-in from leadership and all of that. So go ahead and chime in what you think on collecting data to show impact.
I think pre and post surveys always help. Sending out a survey to your team on where they are from a mental health standpoint or what their education level is as your baseline. And then after you have done programming for a year, whatever that looks like for you, send out a second survey. It really makes a difference. In our world, we measure impact on reach. So how many people are we reaching? What do we know? How many people are requesting swag? How much swag are we handing out? What does that look like for us? Because we know that every time we hand out a coin or a wallet card or a sticker, that somebody has reached that message. So those are part of the ways that we know that we're kind of tracking impact.
Yeah. Ryan, what
And
about you?
yeah, at Hard Hat Courage, every resource, every program has a survey. We use what's called a retrospective pre-then post. Essentially, it asks questions once at the end of a program or a presentation. And we have a whole team of PhDs that are impact measurement focused, and we want to know not only how many people are we reaching, but are we changing their attitudes and minds about certain things that we believe will change their behaviors? So if people if as a result of our presentation for Talk Saves Lives, people are changing their mind about suicide being preventable, they're more likely to engage in behavior that prevents suicide, whether that's reaching out for help for themselves or checking in on someone. So we measure all of those things. We also look at like program satisfaction as well. And for Talk Saves Lives, I think our most recent data block we analyzed was that 98% of people said they would recommend it to someone else. And so that's really important for us. Not only is it changing people's minds about things that we know will lead to preventing suicide, but also are they satisfied with the program? Because it would be really awful to, push a program out that people don't really like.
Yeah. From us, from a company perspective, when I think about data, I think about usage of resources and benefits for employees. Like our employee assistance program, we track the utilization and look to see are people actually using the resources that we provide. So I think that can also be something that, from a company perspective, you look at, like, are people actually using the resources that you provide them? But thanks for asking that question. Another question came in. The Senate has introduced legislation to study deaths by suicide in the construction industry. What research do you think is needed on this issue? And I know, Sonya, you have connections with CPWR, who's doing research already. I don't know if you want to share anything about that.
Yeah, I'm really excited, obviously, that this Senate committee has been formed and that they are looking at construction suicide and construction mental health. It looks like there is a lot of co-sponsorship. It appears to be bipartisan, so that is all very exciting. I mean, there already is a mental health coalition in both the House and the Senate. So that is also really encouraging when you look at, what's happening. I think that things that should be studied are root cause analysis. So, what is it about construction? We have a lot of anecdotal evidence on our risk factors. But what are those root causes really deeply ingrained in that? How does psychological safety really play a part in this conversation, and what can be done to, instead of just saying, well, that's just the nature of construction, what can we do from a scheduling standpoint? What can we do in from an ergonomic standpoint? And what are some of those things? So I think that this committee certainly has, or the legislation certainly has a lot of places they could go with this. But I also know that, as you said, there's people that are already doing this research. University of Colorado has been doing it for years. University of Washington has been doing it for years. WashU. There are people in Oregon that have been doing this for years. I think that there's lots and lots of places that are, just kind of out there already looking into it. And if they utilize the resources that are available, we could get some really great things accomplished.
Yeah, I think that's the Constructing the Path to Suicide Prevention Act in Congress, right, for this
Okay.
study. And I
Yeah.
think, Sonia, yeah, looking at those risk factors are some things we kind of know about, but we want to, get that confirmation, and it'll help us lead to some other, breakthroughs, hopefully, in this. And Sonia, as you mentioned, there's a lot of other people doing research. We've also commissioned a study as an implementation science kind of a thing to look at what's working and why is going to be really important in terms of like prevention education. So it's exciting though to see the government, the Senate, take action on something that has become a really big movement within the industry, to get behind it, to support it, and add to the body of evidence so that we can, those of us that are doing the work, the companies, the nonprofits like the three of us on this webinar can have more robust information at our disposal to utilize in order to prevent suicide more effectively.
Yeah. Thanks for bringing up that question. Looking through, I think we've covered the questions that come in. I know some came in about different resources, and you all put in the chat. We can also, in our after email, we can share some of the resources like the virtual 5K and the Hard Hat Courage, different things that you put in the chat. So we'll try to combine that when we send out the recording for folks. So I think we made it through. If there's any other last minute questions, feel free to put those in, but I think we can go ahead and start closing out our webinar. We've really appreciated hearing the perspective from two wonderful organizations, Construction Industry Alliance for Suicide Prevention and American Foundation for Suicide Prevention. We do want to recognize that there are plenty of other people and groups in the industry who are doing important work in this space as well. We're all working together towards this important mission of decreasing suicide and opioid overdose deaths when you think about that holistically. So we encourage everyone to participate in Construction Suicide Prevention Week. But if you're using our resources or CIASPs or AFSPs, or if there's another group in the industry that you're connected with, feel free to use their resources too. We really want to be a starting point for people to start that conversation and then keep the conversation going year round. So please register for Construction Suicide Prevention Week. Visit constructionsuicideprevention.com to find that participation that you can do for free. Find our resources. Thank you so much to Sonya and Ryan. Thank you to everyone who joined us today. Like I mentioned, we will send a recording out of this to all the registered attendees, and we encourage you to share it. Share it with other coworkers, other people in the industry that you know, so we can share more about our mission and more about the resources that we have available. So thank you all so much. I hope everyone has a great rest of your day, and we'll talk again soon. Thanks for all your work.
Thanks, everyone.